Hi, my name is Donovan Straczynski. I am a Hack nursing student, and today I would like to be going over some components of personal hygiene and how to move and position a patient comfortably and move them from a sitting position using a gait belt into a chair. So first, I am going to do the positioning, but before I start, I would like to go over the checks that I would do before I would go near a patient or do any type of procedure to them. So I would go over my 5 rights. I would make sure it's the right patient, right med, right route, right dose, right drug, and right time. I would go over my IIE apples, which would be identify self, identify the patient ×2, go over allergies, go over pain, go over privacy. I would lock the bed to make sure it doesn't roll anywhere. I would elevate the bed to the appropriate height for what I'm doing so it's more comfortable and easy for me to work. And then I would sanitize my hands. After I would leave the room in any type of these scenarios, I would restore the room, I would sanitize, I would record, report, and reevaluate. So first I'll begin so the patient sitting in a sitting position like so. I would assess my environment and just kind of cater anything they need based on what's going on. I just wanted to go over how to comfortably position a patient when they're laying in a lateral position. So here, we'll lay to the side like this. I would make sure they have a pillow here on their head so that they're aligned evenly. I would take another pillow here, and now these are rather large pillows, but I would work with what I have. I would place one over the arm here like so. I would make sure her shoulders are comfortably aligned. I would put a pillow, it says rolled pillow, so under the patient back. So at this point, after they would be comfortable, I would assist them into a sitting position from here. So now I would and there would be a pillow in between the patient's legs as well. So from here, if they were in a lateral position, I would move them to a sitting position so that I could get my gait belt on and move them to a chair. So I'm going to do that now. I'll remove this pillow here. Here. Okay. Legs. Hips. Up. So after I have the patient in a sitting position, I would be moving them to probably a wheelchair, but all I have here is a chair. I have here a belt, which I'm going to be using or pretending to use as a gait belt. I would take the belt, arms up. I would position it for her here, right below the breast line, right here. And I would make sure I could at least get 2 fingers within, then it's not too tight. So from here, what I would do, kind of want you to see my legs here, is I would hold on to one hand with the gait belt, one hand on the shoulder. What I'm going to do is her dominant foot, which would be this one, right? I'm going to support her dominant side. So I'm going to have the patient, I'm going to support the shoulder and have the patient sit up. I'm going to put my foot or my knee blocking hers right here. So I'm going to have you sit up. Good. After I have the patient standing, I'm still going to maintain as much control as I can so that the patient doesn't lose control. I'm going to guide them into my chair or wheelchair. I would make sure the wheels are locked if it is a wheelchair. I would position staying in front of the patient, so, and then I would have them sit and make sure their arms are resting on the sides. And from here, I would take the gate belt off. Okay. All right. So from this point, I would get into the hygiene portion of things. So I'll first go over oral hygiene on a conscious and unconscious patient. So I will have her kind of sitting here. So I'm going to have her lay back on the couch here. All right, so for oral hygiene, I would assess the patient's mouth. I was reading that if they have poor oral hygiene and you're too aggressive when you go to brush or stick the Yankauer hose in, you could actually cause the patient pain or maybe chip or knock a tooth or kind of damage something that really isn't supposed to. So I'll start with an unconscious patient. For an unconscious patient, I would need a Yankauer suction tube. It would be between the strength of 80 and 120 millimeters of mercury. I would position it right at the gum line, around the gum line as I'm suctioning to suck the water out. Also, I would have the patient sitting more in an up position if they're unconscious. I would have their head tilted, and then I would have my pretend hose in like this. I would take a toothbrush, toothpaste on it, and I would go at a 45-degree angle just below the gum line, and I would brush. I would, scrape or clean the tongue. For a conscious patient, the steps are kind of similar. However, I would have a basin that when I'm brushing, I could have the patient spit into if they're capable, and they're able to do so. Again, I would have the patient rinse with a sponge and have them bite down and kind of spit out to rinse. And if they would like, I would have mouthwash available if they needed, or if they were elderly and they had dentures, I would have denture cleaner available and ready for them to have. Okay, so from this point, I'm going to move on to the final portion, which would be the 10-step bath process. And so what I would do to the patient, I would offer a bedpan or check and make sure they don't have to go to the bathroom first. And if there is visible stool present, I would remove it with a piece of toilet paper or something like that to remove it before I would get started. I would lower the bed. I would explain to the patient what's going on. I would have them remove their clothes. I would lay blankets over them and I would place something under their head. I would then go run a bath. I believe it says about 103, 105 degrees of water with my washcloths. I would also don gloves while I'm doing this. So I'll have her sit up here. I have my washcloth, or what I would use. So for this one, I'm actually using 5 washcloths, and I'll explain when I change the washcloths as I'm showing what I'm doing. So the first step with the first washcloth, I would wash the eyes. I would do them, if you could take your glasses off, from inner to outer. Make sure that you're not using soap when you do the eyes for obvious reasons, because it will burn. I would fold the cloth after each wipe. Then I would offer the patient, if they're capable, if they would like to wash their own face and ears and rinse them dry. If not, I would do that as well. I would wash the face and the ears. I would rinse and then dry. Then the third step would be I would wash the neck, the chest, and the abdomen. Again, after I'm doing this, I would rinse dry. I would also move to the under part of their arm while I'm doing this. And I'm always moving distal to proximal, especially when I'm doing the extremities to promote venous return. Then I would wash the right and left fingers, hand, arm, and armpit. I would also rinse and dry. And again, I'm going from distal to proximal. So when I'm doing this, I'm doing the hand, I'm doing the arm, and then I'm going up to the armpit to clean again. I'm rinsing and drying as I'm doing this. Then as I move to the legs, this is still the first washcloth. As I'm doing the legs, I would go from ankle to leg to the top of the groin. Again, distal to proximal is what I'm doing. So after we have all of the extremities, the abdomen, and the face cleaned, I'm going to move to my second washcloth. And after the eyes, you're using soap here to kind of clean. All right. So I would position the patient in a dorsal recumbent position for this, and I'll show you what that looks like. So if the patient lays down, and then I would have their legs like that, and I'll move this one up just so you can see the other one. But that's how I would have the patient. I would drape gowns over for their privacy, if they, well, all times I would think. So from here, I would wash the anterior perineal area, wiping front to back. Again, when I'm doing this, I'm folding the cloth after I wipe. And that's very important, especially when you deal with this type of area, because you could cause infection or something that you don't want if you don't clean properly. The other thing is, so after I do that, I don't use that washcloth again. So I discard. Now I'm on my third washcloth. I would rinse the anterior part of the peri. Again, I'm wiping front to back. I'm folding after each wipe. Okay. So after I do that, I roll the patient to the side here. After I wipe front to back, again on my third washcloth, and after I discard that, I dry. So then I'm moving to my fourth washcloth. Now this is kind of like so now I'm washing like the back of the patient. So I'm gonna wash the neck, the back, and the butt, and I'm also gonna rinse dry. I'm also gonna wipe the posterior, wiping front to back, again with the laundry cloth, and I'm discarding that as well. For the fifth washcloth, it's the posterior peri, wiping from front to back, and again discard the cloth and rinse and dry. After I'm done with this whole process, I offer a 3 to 5 minute back rub with lotion. And then I would restore, sanitize, record, report, and reevaluate after I'm done. Again, I would make sure they're in clean clothes when I'm done, and that the patient wouldn't need anything. I forgot to mention, while I'm getting or drawing the bath for the patient, I would give them the call bell, just in case anything were to happen in that time where I could run and see what was going on with the patient. So those are kind of the steps I would follow for personal hygiene, oral care, and bath. And those are the steps on how I would assist the patient from sitting into a wheelchair or a chair, and I would make sure it's locked and that their arms are kind of on the side there. Thank you.